So I did the program in 2.5 years, so I finished kind of mid-year in December. So it's so great to listen to the students who've gone before, because I just had just a rush of memories about all sorts of things. My cohort, how much I loved them, and the self-rev process, and the practicum experience. It's just I had a fantastic experience at CIIS, and then and now post CIIS. And I think one of the first things I realized coming out, I also was fortunate to get a job like 3 days after my self-rev. I started a job, and it was due to my practicum. My practicum was working with incarcerated women who struggled with addiction issues. Well, there was half the group was incarcerated and half the group was in residential treatment. They lost the contract with the prison now, but it was for women and young children who had drug charges. They were in a residential setting. And so I went into drama therapy, sometimes successfully and sometimes horribly with them. But that's what your practicum is about, is figuring it out and making mistakes and learning and living through it and growing. So because of my experience with addiction, though, I got a job right out of school working with pregnant and postpartum women who struggled with opiate addiction. And I was there for 2 years. And the first thing I really realized there was, because there were interns, marriage and family therapist interns, so you have hours you have to accrue after graduation before licensure, so they call you interns. And there were interns from all different programs in the city, not drama therapy, but different psychology programs. And the first thing I realized was how solid our clinical training here was. That I had this extra amazing like background in drama therapy and all these extra skills, but the foundational counseling psychology was as strong, if not stronger, than a lot of the colleagues that I was working with as far as understanding and theory. And so I was pleased, I guess, about that I felt like we went out into the world with as much of a good counseling psychology foundation as people that I was meeting from other programs. So that was exciting. So I worked there for 2 years, and after that I joined the Living Arts Counseling Center, which is run by adjunct professor Armand Bocas in the East Bay. And it's a nonprofit agency, but it kind of preps you to go into private practice. So we ran groups and worked with individuals and couples. And then after getting my MFT license, I opened a private practice. So that's where I am now. I do part-time contract work sometimes with an agency, again, Women in Recovery, so I will go in and do groups at the agency in San Mateo, and then have a small private practice, which I'm hoping to build, but I have a toddler at home, so I feel like I'm like part-time therapist, full-time mom, not part-time mom, full-time mom, part-time therapist. I think that like going through the 2.5 years of the graduate program in conjunction with my own personal therapy, like, in my brain, there's like a before CIIS Sarah and an after CIIS Sarah. Like the growth was so huge, and I'm noticing like the continued effects as I became a parent, and like how I'm parenting now. And I just think that some of that foundation of being a mom came out of this program, and just kind of learning how to better connect and mirror emotions and all that kind of stuff. So doesn't mean I'm like. We laugh with other therapists about like intellectually knowing child development and then having your toddler in the room and yelling at them first. It's totally different. Like I'm not like a therapist with my kid, but I do see the effects of the work that I did on myself in my personal life as well, and in my relationship. And so there's a lot of like academic foundation and a lot of personal growth. And you put them together, and it's just, a transformative experience. You do kind of get sucked into the Bay Area, I think. My intention was to move here, do the program, move back to Oregon, and that didn't happen. Although a lot of my cohort members have moved out. So we're 7 years out, and there are several of my cohort members on the East Coast, and a couple in the South, and a couple in the Northwest. So you can move out, but it takes there is a lot of opportunity here, and people know what drama therapy is, and so There's a good nurturing community of drama therapists and colleagues. And the cohort that I went through with 7 years ago are still sometimes the first people I call when I want like consultation or to talk things through. And some of my very closest friends are from that cohort. And yeah, so that's really nice to have that kind of built-in community in the